Hi everyone. The big takeaways from Chapter 12 on psychological disorders are these. First big takeaway is about the continuum between normal and abnormal. Psychological disorders, also known as abnormal psychology, I teach that class by the way. Psychological disorders are experiences of the perfectly normal thoughts, feelings, and perceptions taken to some extreme in intensity and in duration. They last a long time. You'll see in this chapter abnormal anxiety, for example, that is just out of proportion to the situation. That anxiety that goes too far, it's too intense or lasts too long duration, and crosses a line into abnormal. We recognize these thoughts, feelings, and perceptions, anxiety and depression, in their mild forms as normal parts of human experience. It is in the extremes here that draw our attention, the attention of mental health caregivers. Be sure to watch the video clips for this chapter in particular. You'll hear patients who seem perfectly normal people, but they're feeling and thinking negative things involuntarily. If they could stop the negative thoughts, the feelings, they would. They can't, and that's why we call it a disorder. Second big takeaway in this chapter is the typical treatment happens in two steps. Medications come first, usually prescribed by a psychiatrist, by the way, followed by talk therapy with a psychologist. Treatments for disorders like depression and anxiety start with doses of mild medications called antidepressants. In the case of like Prozac or Zoloft, in the case of anxiety, they'd be called anti-anxiety drugs like Xanax or Valium. A psychiatrist, who is a medical doctor, prescribes these medications to immediately help the patient who comes into us in distress, in crisis. So we do that first. Step 2 is treatment that is a talk therapy with a psychologist to pinpoint and stop the thought processes that are contributing to depressed feelings and anxious feelings. Remember that thoughts create those unpleasant feelings, so we want to stop or redirect those thoughts. That's the job of a psychologist. This two-step process is common to almost all psychological disorders that we'll discuss in this chapter. Medications come first and is considered a short-term solution. Talk therapy comes second, and that's considered a long-term solution. The final big takeaway in this chapter is about differences between women and men in presenting symptoms of psychological disorders. This observation sounds like gender stereotypes, but there's enough truth here for psychologists to watch for. Let me explain. All over the world, women are more likely than men to report suffering from depression or anxiety. But let's do some critical thinking here. Women report depression and anxiety more, but that does not mean that men experience it less. Despite the research data telling us that women report more, practicing psychologists believe that men experience depression, anxiety, and other psychological disorders just as often, but they do not report it as often when asked. Perhaps this is due to gender stereotypes about men not wanting to admit weakness, feelings of hopelessness and helplessness. To escape those feelings, we observe men, and sometimes women, who deal with their feelings by using alcohol and drugs to self-medicate. Self-medicate means to make themselves feel better. Psychologists believe that women and men suffer about equally from depression and anxiety, but just may express it differently. And women are just more likely to reach out for help and support. Interesting, right? Okay, so in summary, the big takeaways from Chapter 12 on psychological disorders are these. Number 1, psychological disorders, also known as abnormal psychology, that's the other class I teach, are experiences of the perfectly normal thoughts, feelings, and perceptions just taken to some extreme in intensity and in duration. They last a long time. Big takeaway number 2, typical treatment happens in 2 steps. Medications come first in the short term. Talk therapy comes second as a long-term solution. By the way, watch for our next chapter called Therapies to elaborate on these treatments and also how they work. Third big takeaway, gender. Psychologists believe that women and men suffer about equally from depression and anxiety, but they may express it differently, so psychologists watch for this. Those are the big takeaways from Chapter 12 on psychological disorders. Thanks, everybody.